So we have reached our scheduled time, that is 7 p.m. And now we are starting the webinar. Thank you so much everyone for sharing your answers in the poll questions shared over the screen. We have the most number of responses for kidney health issues. Okay, let's see during the webinar the right answer for this one by our expert. So thank you so much everyone for joining in on the occasion of this World Health Day. We are here with you to guide you on your specific health related issues and to be there as a healthcare partner. So namaste, Sat Shri Akal, Salamu Alaikum, and a very fresh good evening to everyone. This is Sanghamitra, leading the care management team at Zyla Health, and I'm your host for the evening today. For a quick introduction, and to start with, Zyla Health is India's leading AI-powered health management platform that is serving 2 lakh plus patients in 595 plus cities and happens to be the highest rated app with a 4.8 plus rating and delivers 24/7 care. We have been helping people with multiple health conditions such as COVID, diabetes, heart issues, kidney health issues, and women's health issues through a very able and experienced team that is in-house at Zyla for the highest quality care. So as we all know, there are numerous functions and activities that our body performs in complete automation on a daily basis. But whenever something is wrong, it gives us indicators to identify and resolve it. That is why it is rightly said that we must listen to what our body is saying. But what are those secret messages or the indicators that our body is trying to share, and how to decode it to find the right steps of treatment? So to understand all this, today we have with us Dr. Gunjeet Madan, who is a general physician. She has previously worked at JJ Hospital and currently providing her services in patient care at Zyla. We are very delighted to have you among us today, Dr. Gunjeet, and looking forward to this informative, insightful session with you. So
thank you so much, Sangha.
So we would be starting the webinar now. If anyone has any questions, आपके कोई भी सवाल आते हैं webinar के दौरान, तो आप chat box में अपने questions share कर सकते हैं. हम आज webinar के अंत में आपके सारे सवालों का जवाब जरूर देंगे. So over to you, Dr. Gunji.
All right. So today we're going to talk about, like Sangha mentioned, the 10 secret messages that your body might be giving you on this occasion of World Health Day. And we came up with this basically ताकि आप लोगों को अगर आपको ऐसे कुछ symptoms मिलते हैं या आपको signs, you notice these things, तो आप जल्दी से जल्दी डॉक्टर का opinion, डॉक्टर को consult कर सकते हैं, या you can catch diseases early, because however early you catch a disease, आपका prognosis उससे improve होता है. So let's see what are the 10 secret messages that our body gives us, and we'll go system wise. ठीक है. Next slide. So what is the importance? क्यों हम आपको क्यों बता रहे हैं कि आप ये changes अपने body में observe करो? Because बहुत से cases ऐसे होते हैं जहाँ ये non-specific symptoms, like very unobtrusive symptoms, आपको ऐसे कुछ लगेगा नहीं कि कुछ actually हो रहा है. But some of these non-specific symptoms can be the first sign. ये पहला sign हो सकता है कि कुछ disease आपके body में शुरू हो गया है. For example, vivid dreams, मतलब बहुत ही interesting सपने, या आपको ऐसे लग रहा है कि you are awake. Those kind of dreams can be an early sign of Parkinson's disease, right? So it's a very, very unusual symptom. It's not even a symptom, but अगर आपको ऐसे कुछ हो रहा है, तो it can be a sign कि आपके body में Parkinson's शुरू हो गया है. आप सिर्फ vivid dream से अपने आप को diagnose तो नहीं कर सकते, but if you keep a track and if you start noticing कि आपको बार-बार ऐसे बहुत ही vivid dreams आ रहे हैं, then you can mention it to your doctor, and coupled with other changes in your body that Parkinson's will bring, we can diagnose you early. And this is why we recommend that regular self-exams are very important. Make note of any changes. You should look at your body, especially your skin. The skin is the largest organ in the body. आपको वो सबसे visible दिखता है. तो make sure आपको कोई moles है, कोई growths है, कुछ भी आपको ऐसे दिखता है, कोई भी lumps, bumps, swelling, जो भी आपको visually दिखता है, आप उसे touch करके feel करके आपको पता चल जाएगा कि this is unusual. And what we usually do in our exams is that we compare with the other side. तो आपको अगर एक नी में स्वेलिंग है, आप दूसरे नी पे ऑन द अदर नी आप हाथ रख के पाल्पेट कर सकते हो, फील कर सकते हो, आपको पता चल जाएगा कि किस नी में स्वेलिंग है और कौन सा नी नॉर्मल है। तो ऐसे आप कंपैरिजन भी कर सकते हो फ्रॉम वन साइड टू द अदर। ठीक है, सो मेक अ नोट ऑफ एनी चेंजेस इन योर बॉडी एंड ब्रिंग इट अप विद योर डॉक्टर। यू शुड हैव एन ओपन डायलॉग विद योर डॉक्टर, ब्रिंग दीज चेंजेस अप सो दैट इन केस देयर इज एनीथिंग, वो जल्दी से जल्दी डायग्नोस हो सकता है। ठीक है, नेक्स्ट स्लाइड। So let's take a look at some of the messages. हमें हमारी बॉडी हमको कौन से मैसेजेस देती है, let's look at some of them. ठीक है, next slide. So we have covered 10 systems. We've covered heart, the hormones, kidneys, lungs, brain, skin, nails. They are very important indicators. हम अपने स्किन और नेल से ही बहुत कुछ जान सकते हैं, हमारे गट से बहुत कुछ जान सकते हैं, हमारे रिप्रोडक्टिव सिस्टम से बहुत कुछ जान सकते हैं, as well as our eyes. So let's look at what each of these systems tell us. ठीक है, next slide. So messages from our heart. अभी आपको मैंने स्क्रीन पे ये एक इमेज है, these are clubbed fingers, और ये बहुत स्पेसिफिक नेल्स जो होते हैं बिल्कुल स्पून लाइक दिखते हैं। एंड these kind of nails are very specifically seen अगर आपका ऑक्सीजन कम है तो ये हार्ट डिजीज में दिखता है, लंग डिजीज में दिखता है। एंड दिस इज वेरी 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 प्रोमिनेंट। आपको जनरली इस स्टेज तक आपको डायग्नोस हो जाना चाहिए। इन केस आपने ऐसे नेल्स देखे और आपको कुछ हार्ट डिजीज या लंग डिजीज डायग्नोज नहीं है, देन इट्स अ गुड टाइम टू टॉक टू योर डॉक्टर एंड से दैट लुक दिस समथिंग्स रॉन्ग विद माय नेल्स, मेरे नेल्स में इट्स लुक्स डिफरेंट, एंड दे कैन एग्जामिन यू एंड देन टेक द इन्वेस्टिगेशंस फर्दर। Another very important sign that people come with, बहुत लोगों को palpitations होते हैं ना। palpitations का मतलब क्या है? जब आपको अपनी हार्ट बीट सुनाई देती है, that is called palpitations. आपको वो धड़क धड़क धड़क, you will be able to hear it. Normally आपको ये सुनाई नहीं देना चाहिए, और अगर आपको ये सुनाई दे रहा है, then it is a good time to talk to your doctor, because a lot of times people with arrhythmias, which is what palpitations are usually a sign of, आपको you can faint, or it can be a cause of some other very deeper heart issue. So it's always better to get these things checked out. Normally भी हमें palpitations हो सकते हैं, जैसे अगर आप बहुत stressed हो या आपको बहुत anxiety है तो भी आपको ये palpitations experience हो सकते हैं, महसूस हो सकते हैं। However, still अगर आपको बहुत बार हो रहा है, it's always better to get it checked out. साल में एक बार ECG कराओ, if your age is above the if you're above the age of 40, it's always good to get these things checked out, especially for heart health. Now if you look at heartburn, मतलब आपको ऐसे जलन होती है चेस्ट में या पेट में दर्द या पीठ में दर्द, काफी केसेस में अगर हम फीमेल्स को देखें, उनमें ये साइंस, दीज आर साइंस ऑफ अ हार्ट अटैक। उनको वो नॉर्मल टिपिकल जो हम चेस्ट पेन देखते हैं, चेस्ट पेन नहीं होता है, उनको ये बहुत नॉन स्पेसिफिक सिम्टम्स होते हैं। तो अगर आपको बार बार हार्ट बर्न हो रहा है और आपकी फैमिली हिस्ट्री है ऑफ हार्ट डिजीज, और आपको स्वेलिंग हो रहा है, या आपको पाल्पिटेशंस हो रहे हैं, या आपको ऑल ऑफ दीज सिम्टम्स, और आपको लग रहा है कि समथिंग इज रॉन्ग, एंड it's always good to get it checked out. You can get an ECG done once a year. You can talk to your doctor. Anyway, these things are something that you should treat in case of acidity and indigestion. So make sure you talk to your doctor, especially if you're a female. अगर आपको ये सब symptoms है, heartburn, stomach pain, back pain, these are very non-specific symptoms and they can indicate a deeper heart issue. स्वेलिंग इन द फीट, ना अगर ये बहुत लोगों को होता है, जनरली जिनके डाइट में सॉल्ट ज्यादा रहता है, या बीपी का प्रॉब्लम रहता है, या आप बहुत देर खड़े रहते हैं और आपका वेट भी बढ़ा है, देन ऑल्सो आपको पैरों में स्वेलिंग हो सकती है। हाउएवर इट इज ऑलवेज गुड कि आप एक बार अपनी डॉक्टर से बात करवा के दिखा दीजिए, सो दैट वो आपको या तो वो रेकमेंड करे कि आप अपने डाइट में सॉल्ट कम कर दीजिए, बीपी और ब्लड शुगर को चेक में रखिए, और एक बार, but this is a sign कि something is wrong. Either you have to reduce your weight, or you have to get your heart checked, or you have to get, do dietary changes, because swelling in the feet is not a good sign. It is a sign कि आपका जो blood है, जो पैरों से ऊपर हार्ट तक जाना चाहिए, वो ठीक से नहीं जा रहा है, और वो वहां ही stagnate होके वहां fluid buildup हो रहा है. So make sure you get this symptom checked out in case you see it. ठीक है, next slide. Now some other messages from your heart. अगर आपको बहुत थकान होती है, now this kind of tiredness can be a symptom of many things. It can be a symptom of depression. It can be a symptom of it can be a symptom of hypo or hyperthyroidism. It can be a symptom of even heart disease. So अगर आपको बहुत थकान हो रही है और इसका मतलब ये है कि आप मतलब जो आपका नॉर्मल एक्टिविटी है वो भी करना आपके लिए बहुत एफर्ट है, then it's better you get this checked out. कभी कभी हो सकता है that it is a mental health issue or you're burnt out या आपको बहुत स्ट्रेस है इसीलिए हो रहा है, but oftentimes it can also be a sign of something else that is wrong. So and it can be a very non-specific sign. ये recognize करना काफी मुश्किल है, मगर आपको अगर ये familiar sound करता है then please get it checked out with your doctor. Another thing that is a very prominent sign is अगर आपके fingers और lips if they get blue, then this is a sign कि आपके extremities को oxygen ठीक से नहीं मिल रहा है. Now this can be a sign कि आपके end arteries में blockage है या आपको कोई autoimmune disease है. So in this case also, especially if you're turning blue on your lips and your fingers, please get it checked out. And get it checked out earlier rather than later. ये yellowish growths on and sometimes if you have yellowish growths, अभी ये जो picture देख रहे हैं आप screen पे, this is a yellowish growth on her eyelids. And this is a sign कि आपके cholesterol levels high है. Now this is something ये जो आप देख सकते हैं और काफी patients pictures भेजते हैं, मैंने ऐसे actually देखा है. So it's quite possible to see this on your eyelid. और अगर आपको ऐसे growths दिख रहे हैं, yellow growths, not only on eyelids, this is called a xanthelasma, but it can काफी other parts पे भी आ सकता है. It will be a yellowish fleshy growth और उसमें पेन नहीं होगा आपको या ऐसे कुछ हार्ड नहीं होगा, काफी फ्लैशी होगा. इसको देख के आपकी बॉडी आपको बता रही है कि आपके ब्लड में कोलेस्ट्रॉल ज्यादा है, इसीलिए वो स्किन में डिपॉजिट हो रहा है. एंड दिस इज अ गुड साइन कि आप अपने डॉक्टर को जाके दिखाओ तो वो आपका लिपिड प्रोफाइल करे और अगर जरूरी है आपको मेडिकेशन स्टार्ट करनी पड़े. ठीक है, अगर आपको पेनफुल लम्प्स हैं फिंगर्स और टोज के नीचे, फीवर है, दिस इज अ साइन कि आपके हार्ट में कोई इंफेक्शन है. इट्स कॉल्ड एंडोकार्डाइटिस. एंड जनरली आपके बहुत अदर सिम्टम्स होंगे जिससे हमें पता चल जाएगा, बट इन केस आपका दिस इज द ओनली सिम्टम यू हैव, और ऐसे केसेस होते हैं. अगर आपको ऐसे पेनफुल लम्प्स दिख रहे हैं और पाम्स में पेनलेस ब्लैक कलर का लीजन है, इट इज अ साइन की इन्फेक्शन हो सकता है. नाउ दीज आर वेरी, एंडोकार्डाइटिस इज रेयर, बट द थिंग्स दैट यू शुड रिमेंबर, कांस्टेंट फटीग, आपको थकान है, पैरों में स्वेलिंग है, अगर आपके लिप्स और फिंगर्स ब्लू हो रहे हैं या ऐसे कोई येलोइश ग्रोथ है, दीज आर द 4 मोस्ट इंपॉर्टेंट वंस दैट आई वुड सजेस्ट यू शुड कीप ट्रैक ऑफ. ठीक है, नेक्स्ट स्लाइड. Now, our hormones are responsible for a lot of functions in our body. And often जब हमारे हार्मोन्स में कुछ ऊपर नीचे होता है वो हमारी बॉडी में बहुत इजीली दिख जाता है. जैसे समथिंग कॉल्ड अकैंथोसिस नाइग्रिकैंस, दीज आर डार्क वेलवेटी पैचेस. ये एक ब्लैक कलर का लीजन रहेगा आपके, या तो नेक में आएगा, आर्मपिट पे आ सकता है या ग्रॉइन एरिया पे आ सकता है. एंड ये प्री डायबिटिक पेशेंट्स, ओबीस पेशेंट्स जिसमें इंसुलिन रेजिस्टेंस है या डायबिटीज डेवलप होने वाला है, इट इज वेरी प्रोमिनेंट. आपको समझ में आ जाएगा. एंड इट कैन बी अ वेरी गुड इंडिकेटर. आपको आपकी बॉडी बता रही है कि समथिंग इज नॉट राइट, प्लीज गेट इट चेक्ड आउट. एंड यू विल नोटिस इट विल बी अ वेरी डार्क कलर्ड एंड आप टच करेंगे तो वेलवेटी और सॉफ्ट रहेगा. सो पे अटेंशन टू दिस. एंड अगर आपको, इफ यू हैव नोटिस दिस, मेक श्योर यू गेट इट चेक्ड आउट with your doctor, get your blood test done so that आपका diabetes या insulin resistance can be brought under control. Now this purple stripe, ये जो picture है हमारे screen पे, these are purple stretch marks जैसे लगते हैं and ये abdomen पे आ जाते हैं और बहुत weight gain होता है. If you have marks like this and they will be very purple, then it could be a sign कि आपके cortisol levels में थोड़ा issue है. And this is again something that you should get checked out by your doctor. It's called Cushing's disease. And at this point, अगर आपको ऐसे दिख जाए, यूजुअली जिन लोगों को होता है ऑलरेडी वो डायग्नोज हो चुके होते हैं. हाउएवर अगर आपको ये दिख रहा है और आपका वेट बढ़ गया है, इट्स नॉट अ बैड आइडिया टू गेट योर लैब टेस्ट डन एंड टॉक टू योर डॉक्टर. Another very common endocrine problem or hormonal problem is PCOS. Very common amongst girls who are now who have periods and who are now in the reproductive age. उनको face पे hair acne बहुत होता है, hair loss होता है, weight gain बहुत रहता है, periods irregular होते हैं. All of this is a sign of PCOS and it's a very common lifestyle disease which often is diagnosed only on the basis of these symptoms. USG भी करवाते हैं, but often it's both, it's USG and these symptoms. तो अगर आपको ये symptoms दिख रहे हैं, तो more or less, you can say that yes, something is wrong, and you should go to the doctor so that they can start you on whatever medication is appropriate for you. And because it's a lifestyle disease, आप जितना भी जल्दी इस पे act करो, you can, work on it, reverse it, reduce it at best. If you can't reverse it, at least you can reduce it. Another thing that's very prominent and patients come to us with कि उनको थकान बहुत होती है और उनका वेट बढ़ रहा है. This is a very common sign कि thyroid में कुछ issue है. And women में तो thyroid levels get checked a lot. Men don't get thyroid levels checked that often. So it's important कि अगर आपको ये हो रहा है, joint pain हो रहा है, weight gain हो रहा है, फिर बहुत थकान हो रही है, get your thyroid levels checked, talk to your doctor so that they can appropriately diagnose you in time. ठीक है, next slide. Some other messages that our hormones can give us. अगर आपको weight loss हो रहा है, palpitations हो रहे हैं, then it could be a sign of hypothyroidism. Again, you should go to your doctor so that they can do your thyroid profile और आपका replacement medication चालू कर सकते हैं. Now, the most common disease in India, which is, the diabetes capital, the heart disease capital of the world. अगर आपको बार बार यूरिनेशन करने का अर्ज है, अगर आप पानी बहुत ज्यादा पी रहे हैं, आपका एपेटाइट बढ़ गया है, आपको खाने की बहुत इच्छा हो रही है, these are the 3 classic signs. It's called the 3 P's: polyuria, urinating a lot; polydipsia, which is drinking a lot of water; and polyphagia, कि आपको खाने की बहुत अर्ज है. ये अगर 3 साइंस आपको हो रहे हैं, अगर आपको लग रहा है कि आप बहुत पानी पी रहे हो, बार बार आपको बाथरूम जाने की अर्ज है, एंड आप बहुत खाना खा रहे हो, then please make sure you get your blood sugar levels checked. ठीक है, next slide. Let's look at some messages from our kidneys. Very important organ, and you should really pay attention. अगर आपको ऐसे कुछ भी signs हैं. Signs of fluid overload. हमने पहले क्वेश्चन पूछा था कि संगने had asked you this question कि अगर आपको limbs में swelling है, then is it a sign of kidney failure? Is it a sign of an issue with the kidneys or your heart? And the correct answer is both. When your heart doesn't work properly, it doesn't pump properly, तो भी fluid build up हो जाता है. And when your kidneys are the organs that cycle your fluids and filter your blood, अगर उसमें भी problem हो जाता है, तो भी fluid build up हो जाता है. ठीक है, so अगर आपको fluid overload के signs है, मतलब आपको swelling हो रही है पैरों में, ऐसे सांस लेने में तकलीफ हो रही है, तो it could be a sign कि आपकी kidneys में कुछ issue है, and you should get it checked out. Very important. This is a sign you should not ignore, and kidney health is also something that you should absolutely not ignore. Very hard to replace kidneys, and जब kidneys fail हो जाती है, then your options are very limited, right? अगर आपको लग रहा है कि आपकी appetite कम हो रही है, आपको सोने में issues हैं, और आपको itching हो रही है, ये तीनों चीजें बहुत नॉन स्पेसिफिक है. अगर आपको कोई बोले, अगर मुझे आके कोई बोले कि मुझे खाना खाने की कोई अर्ज नहीं है, या मुझे सोने में तकलीफ हो रही है, या मुझे बहुत इचिंग हो रही है, my first thought will not be chronic kidney disease, but these are signs of chronic kidney disease. So make sure you mention these things, even if you feel like it's irrelevant. Sometimes they can make up a picture, a larger puzzle. It can be a puzzle piece to a larger picture. So make sure you mention it to your doctor. अगर आपको बहुत cramps हो रहे हैं, and this is a very common problem in older people. They don't eat properly, उनको energy नहीं होती अपना खाना बनाने में, and this is something that we have seen. People who live alone, older people who live alone, who are not able to cook well, they often end up getting electrolyte imbalances because वो ठीक से खाना नहीं खा रहे, तो उनको electrolytes नहीं मिल रहे हैं, पानी ठीक से नहीं पीते, they're not able to take care of themselves. So this is a very common problems. Don't ignore अगर आपको बहुत cramps हो रहे हैं और बहुत थकान हो रही है. It can be a sign of electrolyte imbalance, and this is something that definitely needs to be checked out very quickly. ठीक है, next slide. अब हमारे लंग्स से देखते हैं हमें क्या साइंस मिलते हैं. अगर आपको कोई वेट लॉस हो रहा है, थकान हो रही है, रात को फीवर जैसे लग रहा है, चिल्स लग रहे हैं, तो इट कैन बी अ साइन ऑफ ट्यूबरक्यूलोसिस. एंड ट्यूबरक्यूलोसिस इज वेरी कॉमन इन इंडिया, बहुत लोगों को होता है. एंड ऐसे ही और आपको देख के ही समझ में आ जाएगा कि ट्यूबरक्यूलोसिस का पेशेंट कौन है, बिकॉज उनका वेट लॉस इतना ज्यादा होता है. And they look absolutely miserable. So do not ignore these signs, because as soon as possible, if you can start आपकी anti-TB medication शुरू हो जाएगी, then it's better. आई वुड सजेस्ट कि आपको किसी तरह का भी वेट लॉस हो एंड बहुत ज्यादा वेट लॉस हो, while we say that weight loss is good, however अगर आपको बहुत सडनली एंड बहुत क्विकली वेट लॉस हो रहा है, प्लीज गेट इट चेक्ड आउट by your doctor. This can be a sign of cancer, it can be a sign of some infection, some malnutrition. This is something that absolutely weight loss, if you take nothing else from this webinar, आप ये चीज याद रख लीजिए कि आपको कोई भी कभी भी वेट लॉस हो, इफ यू आर अ डायबिटिक एंड वेट लॉस हो रहा है, इसका मतलब है आपकी ब्लड शुगर, आपका डायबिटीज कंट्रोल अच्छा नहीं है. इफ यू हैव वेट लॉस, गेट इट चेक्ड आउट, दैट इज द ओवरआर्चिंग मैसेज. ठीक है. अगर आपका स्टैमिना कम हो रहा है, आप एक्सरसाइज कर रहे हो और आप नोटिस करिए कि आपको आपकी सांस बहुत जल्दी फूल रही है, इट कैन बी अ साइन कि आपके लंग फंक्शन में कुछ इशू है. मेक श्योर you get checked out. Someone puts a stethoscope to your chest and listens in case there is any infection, any reduced lung function. कोई भी issue है तो they can see it, और आपके pulmonary function test हो सकते हैं. ठीक है. और बहुत लोगों को आजकल because of pollution we have something called COPD. Chronic bronchitis is very common. Mucus production बहुत बढ़ जाता है, और ऐसे आप जब सांस लेंगे तो ऐसे whistling sounds आएंगे. आप बहुत लोगों को adults को अस्थमा भी डायग्नोज होता है because the pollution is so bad. तो अगर आपको लग रहा है सांस फूल रही है, या बहुत chronically आपको ऐसे सर्दी आती है, बहुत म्यूकस बनता है, make sure you get it checked out in case it is asthma or COPD. ठीक है. नेक्स्ट स्लाइड. अभी ये हमारा ब्रेन फंक्शन, वेरी इंपॉर्टेंट. दीज आर साइंस दैट विल टेल यू दैट समथिंग इज रॉन्ग विद योर ब्रेन हेल्थ. अगर आपको लग रहा है कि आप कॉन्सेंट्रेट नहीं कर पा रहे हैं, आपको मोटिवेशन नहीं है, आप खाना नहीं खा रहे हैं, आपको बेड से निकलने में बहुत तकलीफ हो रही है, और जो नॉर्मल चीजें आप करते थे उसको करने में आपको बहुत एफर्ट लग रहा है, इट कैन बी अ साइन ऑफ क्लिनिकल डिप्रेशन. एंड अगेन हम लोग इसको बहुत लोग इसको सीरियसली नहीं लेते हैं. Someone will call you lazy, someone will say this and that, but if you genuinely feel that this is not कि आप पहले ऐसे नहीं थे और ये हो गया है, make sure you talk to someone, because depression can get worse without being treated. अगर आप उसको या काउंसलिंग या मेडिकेशन से ट्रीट नहीं कर सकते, then it gets quite bad. So make sure अगर आपको ये साइंस दिख रहे हैं, you talk to someone. Mention it to your doctor. Worst case वो बोलेंगे कि कुछ नहीं है, nothing to worry about. But if it is something, वो diagnose हो जाएगा. ठीक है. ट्रेमर्स, अगर आपको ऐसे लग रहे हैं कि हाथ कांप रहे हैं, आपकी बोलने का तरीका थोड़ा बदल गया है, लिखने का तरीका थोड़ा बदल गया है, एंड आपकी जो मसल मूवमेंट्स है वो स्लो हो गई हैं, इट कैन बी एन अर्ली साइन ऑफ पार्किंसंस, राइट. सो मेक श्योर दैट अगेन आपको ऐसे कुछ भी चेंजेस इन स्पीच, चेंजेस इन राइटिंग, अगर कोई भी आपको बोले कि आपके बोलने का तरीका अलग लग रहा है, और ये जनरली जो आपसे बात करते हैं वो बताएंगे, दिस इज नॉट समथिंग दैट यू विल नोटिस. सो इफ एनीवन टेल्स यू दीस थिंग्स, मेक श्योर यू गेट इट चेक्ड आउट, बिकॉज इट कैन बी अ साइन ऑफ कि ब्रेन में कुछ इशू हो सकता है. अदर देन पार्किंसंस देयर आर अदर डायग्नोसिस एज वेल. मेक श्योर यू गेट इट चेक्ड आउट. इफ यू हैव, आपको ऐसे नमनेस किसी एक बॉडी पार्ट में लग रहा है, या ऐसे इलेक्ट्रिक शॉक जैसे लग रहा है, दीज आर वेरी कॉमन साइंस ऑफ मल्टीपल स्क्लेरोसिस. ये नर्व का एक प्रॉब्लम है, एंड इसका भी अगर अर्ली डायग्नोसिस हुआ तो प्रोग्नोसिस इज वेरी गुड. मतलब आपका yes, prognosis is very good if you get it diagnosed early. So make sure कि अगर आपको कहीं पे भी नमनेस, कहीं पे भी हाथ या पैर सुन पड़ गया, या आपको लग रहा है कि one side of the body is different from the next side of the body, do not ignore this complaint, it can be quite serious. ठीक है. Next slide. Now, like I said, skin is one part of your body that you can see and you should see. When I worked in US hospitals, they would say, and over there they have, उनके यहाँ हर साल उनको एक पूरा dermatologist will do a full check of all the moles, and they will go everywhere. ऊपर से नीचे आपको चेक करेंगे, because skin cancer is something that we can miss. अगर आपको मोल पीठ पे है या शोल्डर पे है, वो आपको दिखता नहीं है, and if that mole is increasing in size, often what happens is it can become quite big and the cancer can advance very quickly, and melanomas can be quite dangerous, even fatal. So in this case, आप जितना अपने आप को observe कर पाओ, if you can go to a dermatologist dermatologist and tell them to do a full body checkup. Nothing like it. But do not ignore moles, tills. ये जो भी आपको appear करते हैं, keep track of them. अगर उनका size बदल रहा है, उनका shape बदल रहा है, अगर उनका color change हो रहा है, you know, black से red या blue, something like that is changing, then make sure you get it checked out. Like I said, worst case they'll say nothing to worry about. और उनके अगर borders irregular है, जिस कोई भी lump या ऐसी कोई growth है जिसका size change हो रहा है या उसका border थोड़ा irregular है, make sure you get it checked out without fail. Like I said, most of the time nothing to worry about, but on the off chance कि आपको कुछ diagnose हो गया, and especially in cases of cancers, it's always better that I'm sorry, can everyone hear me? Sana, can you hear me?
Yes, Dr. Gunjit, we can hear you.
Okay.
I think Mr. Shrikant has not connected to the audio. I'll guide him over the chat and he can then hear.
All right. Okay. So, like I was saying, don't ignore any growth, any change in size or shape of the growth. Sorry. If there's any itching, अगर आपको कहीं पे भी itching है, तो it can be a sign of eczema. It can be a sign of allergies. And बहुत लोग ऐसे itching, you know, के complaint के साथ आते हैं. A lot of times it will be कि आपका detergent change हो गया या आपने कोई अलग soap या shampoo use कर दिया. So it's very easy, you know, to pinpoint these things, and your skin can tell you a lot. अगर आपको red patches हैं, psoriasis is a very common complaint that our patients come with. अगर आपको you know ऐसे लाल रंग का एक लीजन रहेगा या स्केल्स रहेंगे, सिल्वरी स्केल्स रहेंगे और आपको बहुत वहां खुजली होती है, make sure you get it checked out by your doctor, because again psoriasis is linked to your lifestyle, it's linked to stress, it spreads a lot, so and it can get quite bad, I've seen in my experience. So again, if you have any of these things, it's always good, you know, to go to a dermatologist once a year if you have any of these complaints and get them checked out. One very common sign that we see is hyperpigmentation. अगर आपके knuckles dark हो रहे हैं, it can be a sign कि आपका vitamin B12 deficiency है, and it's very easy to see. You can see it and say, okay, yeah, कुछ तो गलत है. You can get your vitamin B12 checked, or you can talk to your GP. They'll get your B12 levels checked. And B12 deficiency is very common in vegetarians. So if you're vegetarian, make sure you keep that in mind and get your B12 levels checked once in a while. Okay, next slide. Sangha, next slide.
So I hope you're able to see slide number 7, Dr. Gunjit.
No, I can't. It's still stuck on 6. Now I can see. Yes, thank you. So messages from your nails. Now nails are another very observable part. ये बहुत आसानी से आपको दिख जाएगा, right? अगर आपको ऐसे horizontal ridges हैं, now that is the picture that's on your screen. आपको ऐसे horizontal lines दिखेंगे nails पे, and it can be a sign कि आपका diabetes control में नहीं है. You know, and that's a very important sign. How else do you know your diabetes is not in control? For some people, it can be unko aur kuch, what about warts? Warts are also something you should get checked out. It can be a sign of, you know, HPV virus. And like I said, any growth, it's always good to get it checked out. अगर आपको लग रहा है कि वो wart size में increase हो रहा है या वो कुछ आपकी दूसरे, if you have other warts, it's slightly different. Get it checked out. They will take a sample and they will check it for you. Perfectly, you know, reasonable to get a wart checked out. Especially अगर genital region में है, I would suggest get the wart checked out. Like I was saying, horizontal ridges, if you have uncontrolled diabetes, it can be a sign of that. अगर आपके nails pale हैं, now this is something that we use clinically to diagnose patients with anemia. हम लोग नेल्स का पैलर चेक करते हैं, आईज का कंजंक्टिवा चेक करते हैं, तो उनका फेस बहुत पेल रहता है, एंड दिस इज समथिंग दैट यू कैन विजिबली सी, एंड आप लैब टेस्ट भी देखेंगे तो उनका हीमोग्लोबिन लेवल कम रहेगा, एंड यू कैन स्टार्ट पेशेंट्स ऑन ट्रीटमेंट. तो आप भी अपने नेल्स का कलर देख सकते हैं, बहुत वाइट है, देन यू कैन गेट इट चेक्ड आउट बाय योर डॉक्टर. अगर आपके नेल्स बहुत आसानी से टूटते हैं, you know, it breaks very easily and it happens very often, make sure you get it checked out. It could be a sign कि आपका कोई तो vitamin deficient है. Most commonly calcium deficiency हो सकता है, iron deficiency में भी brittle nails हो सकते हैं. So like I said, nail health can tell you a lot, especially from, you know, vitamins या ऐसे कुछ deficiency है, you can get to know from your nails. आपके अगर nails yellow हैं और आप पानी में ज्यादा, स्पेशली women, we wash we wash vessels and stuff. So उसमें बहुत लोगों को nails में infection, fungal infection हो जाती है, which takes a long time to clear. It's very hard. So अगर आपके nails yellow है या बहुत आसानी से टूट जाते हैं, make sure you get it checked out because it could be a sign of fungal infection. या आप पानी में बहुत काम करते हैं और आपके nails में कुछ issue है, then always get that checked out. ठीक है, next slide. ठीक है, now let's look at some messages from your gut. The gut is very important. It is responsible for like 70% of our immune function. बहुत सी immunity हमारे gut से आती है. So taking care of your gut is very important. Listening to your gut is very important because it can signal a lot of things. ठीक है, अगर आपको नींद ठीक से नहीं आ रही है, बहुत थकान हो रही है, it can be a sign कि आपके gut का जो माइक्रोबायोम है, what is a microbiome? हमारे gut में बैक्टीरिया रहते हैं and they create this micro environment which is called a microbiome. And we need a healthy microbiome for good immune function, for it to function well. आपको acidity, so अगर आपको कोई भी चीज है, अगर आपको गैस बहुत होती है, एसिडिटी बहुत होती है, इसका मतलब है आपकी गट माइक्रोबायोम में कुछ तो गलत है, बिकॉज our gut is supposed to be able to take care of itself. ठीक है, सो अगर आपको बहुत नींद अच्छे से नहीं आती है, रात को एसिडिटी बहुत होती है, थकान बहुत होती है, इट कैन बी अ साइन कि आपके गट में कुछ इशू है. इट कैन आल्सो बी अ साइन कि आपको इरिटेबल बाउल सिंड्रोम है. ठीक है, सो मेक श्योर यू गेट इट चेक्ड आउट. And I've said this 100 times and I'll say it 100 more times. Make sure you get any of these symptoms. आपको कुछ भी लगे, you can always mention it to your doctor. Make them listen to you, and make sure your complaints are answered. You get reasons for everything. ठीक है. Then बहुत लोगों में जिनमें allergies बहुत ज्यादा हैं, like eczema. It is thought to be linked to our gut health, क्योंकि क्या होता है कि हमारे gut से proteins leak होके skin को touch करके it causes a reaction. This is a working theory. I'm not sure that the hypothesis is fully proved, but this is one of the possibilities for eczema. So if you have eczema, paying attention to your diet, it can help. And there are anti-inflammatory diets that, you can come to us for, you can go to another dietitian for. A lot of anti-inflammatory diets which help with conditions like eczema, psoriasis, any autoimmune condition, diet helps a lot. If there's any change in your bowel habits, agar aapko diarrhea bahut, if you start seeing diarrhea very often, or constipation very often, this can be a sign कि आपके thyroid में कुछ issue है. Because thyroid is responsible for metabolism, and so the metabolism is responsible for everything, and this can cause कि आपके bowel habits में भी change हो जाए. So again, आपके bowel habits में कोई भी change हो, बहुत लंबे time के लिए change हो, it's not an infection and it's happening very, very often. You are having a lot of diarrhea, or you're having constipation a lot, और आपने fiber भी try कर दिया, make sure you talk to your doctor. ठीक है. And like I said, autoimmune diseases are linked to your gut. So अगर आपको कोई भी autoimmune disease है, take care of your gut. अगर आपको लग रहा है कि आपके gut में कुछ issue है, it can cause so it goes hand in hand. It's it one links to the other. Especially, I would suggest if you have any autoimmune condition, make sure कि you have your diet in place and it has all of the things you need for a healthy gut. ठीक है, next slide. Messages from our reproductive system. So there was a doctor who I knew personally who had bloating, and she was a doctor. उनको ऐसे bloating था, abdominal pain था, और urinary frequency था, and she was diagnosed with ovarian cancer quite late, much later than she should have been, and ultimately she passed away. So the point of this is these are very non-specific symptoms, but this can be a sign of ovarian cancer, right? So if you are especially post menopausal, मतलब आपका menopause हो गया है और आपको ऐसे abdominal pain हो रहा है या pain with intercourse हो रहा है, make sure you keep up with your gynecologist visits, and आपका ये सब, don't ignore these signs, because these very non-specific signs can be a sign of something serious. ठीक है. So urinary frequency, in this case these symptoms come hand in hand. आपको bloating भी है, खाने में तकलीफ हो रही है, abdominal pain है, और आप बार बार आपको urinate करने की urge है और करना भी पड़ता है, then make sure, और 2 हफ्ते से ज्यादा अगर आप ये symptoms notice कर रहे हैं, make sure you talk to your doctor, and you will not know कि आपको ये gynecological problem है. So talk to your GP. They will refer you to the specialist that they think is appropriate. ठीक है. मेल्स में ये बहुत कॉमन प्रॉब्लम है कि उनको बहुत बार यूरिनेट करने का अर्ज होता है. दिस इज समथिंग व्हिच इज एज रिलेटेड. प्रोस्टेट का साइज बढ़ जाता है. दिस इज वेरी 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 कॉमन. सो मेक श्योर यू गेट इट चेकड आउट बिकॉज इट्स अ वेरी अनोइंग प्रॉब्लम टू हैव. बहुत नींद खराब हो जाती है. जस्ट जनरली इट्स वेरी इरिटेटिंग. सो कंसल्ट योर GP who will refer you to a urologist, or go you can consult the urologist directly as well. For women very important, make sure कि अगर आपके कोई breast में changes हैं, आप अपने आप को examine करते हो. Every 3 months at least you touch your breasts, lie down, properly self-examine yourself, including your armpits, and your nipples, under the breast, everything, and make sure कि कोई changes नहीं है. अगर कुछ hardness है या कोई lump है या आपको skin color में कुछ change दिख रहा है, make sure you get it checked out. This is very 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 important. Cannot stress the importance of this enough. ठीक है, next slide. Now the last one, messages from our eyes. For diabetics very important कि आप साल में एक बार अपनी eye checkup करवाइए. It is not a guideline, a very enforced guideline, but I would recommend that if you are a diabetic, you get your eyes checked every year, because diabetes में पहली चीज जो affect होती है is your eyes. You can lose vision completely. So अगर आपको ऐसे floaters दिख रहे हैं, floaters का मतलब है कि आपको ऐसे लग रहा है कि कुछ float कर रहा है. It will be like a circular thing and you can see it. It is not a normal sign. Don't ignore it. Make sure you get that checked out. अगर आपको लग रहा है कि आपका vision blurry है या आपको कुछ vision loss हो रहा है and you are diabetic, please make sure you check it out. Otherwise also, if you get floaters, blurry vision and dark spots, you should check it out. But particularly if you're diabetic, make sure you get an eye checkup every year. ठीक है. एंड अगर आप चश्मे पहनते हो, नहीं भी पहनते हो, तो भी अगर आपको ब्लरी विजन हो रहा है, हेडेक्स हो रहे हैं, आपको दूर का ठीक से नहीं दिख रहा है, पास का ठीक से नहीं दिख रहा है, ड्राइविंग में तकलीफ हो रही है, इट कैन बी अ साइन कि आपको या तो चश्मे की जरूरत है या आपके चश्मे का पावर ठीक नहीं है, और एंड यू नीड टू विजिट द ऑप्टोमेट्रिस्ट एंड इंक्रीज द पावर ऑफ योर स्पेक्स. अगर आपको ड्राइविंग करने में रात को ठीक से नहीं दिखता है या आपको जनरली रात को ठीक से नहीं दिखता है, इट कुड बी अ साइन कि आपका कैटरैक्ट स्टार्ट हो गया है, राइट. एंड आपको कैटरैक्ट के अदर सिम्टम्स भी रहेंगे. थोड़ा विजन में ब्लरीनेस रहेगा, ठीक से ठीक से दिखना आपको, ये प्रॉब्लम आ जाएगी. So at that time, making sure you get it checked. Again, if you're a diabetic, cataracts are a very, very big thing that happen. Make sure you get an eye checkup done every year. And अगर आपको रात को देखने में तकलीफ है, एक बार डॉक्टर से चेकअप करवा लीजिए. अगर आपको लाइट सेंसिटिविटी है, आपको लाइट से बहुत ब्राइट लाइट है और हेडेक हो रहा है, go to your GP. It can be a sign of migraine. माइग्रेन का तो आपको पता चल जाएगा, आपको नॉजिया होगा, सर में इतना दर्द होगा that you need to shut the curtains and lie down. So it's a migraine, and in that case you should anyway consult your doctor. अगर आपको सिर्फ लाइट सेंसिटिविटी है और कुछ नहीं है, then get it checked out. It's possible कि आपका cataracts, it's the early stage of your cataracts which have started. So like I said, don't ignore these signs, because often these signs are a signal कि कुछ और deeper चल रहा है. ठीक है. अगर आपकी आंखें बहुत ड्राई रहते हैं, so it can be autoimmune, it can be an autoimmune disease called Sjogren's, which is very common in females. ठीक है. It can be a sign of a viral infection called Bell's palsy, which causes temporary paralysis of one half of the face. बहुत लोगों में hypothyroidism में भी dry eyes होते हैं, because उनके eyes bulge होते हैं और इसीलिए उनका ठीक से lubrication नहीं होता है. तो dry eyes are something that you should not ignore. A lot of times your doctor will just prescribe you artificial tears, but अगर आपको बहुत persistent problem है, make sure you get it checked out. ठीक है. Next slide. तो what are the 5 tips कि आप इन साइंस को, आपने आज बहुत साइंस के बारे में सीखा है, and you've seen a lot of them, and आपको शायद सारे याद नहीं रहेंगे, but the main thing that I would suggest is, अगर आपको लग रहा है कि कुछ चेंज हुआ है, कुछ लंप आया है, कुछ ग्रोथ आया है, साइज चेंज हुआ है, कलर चेंज हुआ है, these are things you can remember. वेट लॉस अगर आपको बहुत अनएक्सप्लेन्ड है, बहुत 5 to 10 kilos very fast, you've lost in 2 weeks or 3 weeks, make sure you talk to your doctor. These are signs that something is wrong, and very quick changes can usually be a signal that something is going on. Observe the things you can observe, right? Listen to your body. वो बहुत बार आपको पता चल जाएगा that something is wrong. And a lot of patients, in my experience, उनको पता होता है that something is wrong, something is not right. So listen to your intuition. Dismiss मत करो ऐसे complaints को. Even if you don't find one doctor who believes you, find another one who will believe you. Make sure you're heard. That is very, 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 very important. ठीक है? Then self-examine yourself. आपके nails, आपके your hair, आपका skin, आपके eyes, ये सब चीजें आपको बहुत बहुत persistently और बहुत consistently दिखेंगे. And so you can often see these things very quickly. Females में breast self exams are very important because it can help in early detection and complete treatment of breast cancer. So if you have any breast growths, any cancer, you can almost completely treat it if you catch it early. So very important to self-examine your breasts. I would say every 2 to 3 months. Go for regular physical exams. साल में आप एक बार go to a doctor and say, I want you to check me head to toe. And they do this. They're supposed to do this. So they will check you head to toe. Go if you feel like you have any moles or growths, go to a dermatologist and say, I want you to see it. Get annual checkups so that you stay on top of your health. आपको अगर कुछ भी होगा, it gets caught, gets detected early. नहीं तो बहुत लोग सालों साल they don't go to see a doctor, they don't get any blood test done, and then you catch something and oftentimes it's very late. ठीक है? And the most important thing is awareness, not panic. Don't panic अगर आपको कुछ दिख गया. Don't immediately jump to cancer or don't immediately jump to the worst thing that you can think of. Note it down. Remember that you have to talk to your doctor about it. Talk to your doctor about it. And don't delay. Don't just say कि okay, I've noticed something और फिर मैं अभी नहीं बताऊंगा, say 3 or 6 months down the line. Talk to your doctor and get an opinion. Like I said, best case, nothing is wrong. And worst case, if you have found something, then also you would have detected it early. Do not self-diagnose. I welcome you to look up information to find out what it could be, but do not diagnose yourself and do not start any medicine by yourself. Always go by what your doctor says. And like I said, if you don't find a doctor who listens to you, अगर आपको कोई डॉक्टर ऐसे है जो आपकी बात नहीं सुनता है, make sure you find a doctor who you can have an open dialogue with. They should explain what you have. They should take your concerns seriously, and they should help you in the way that you feel comfortable. Okay, next slide. I think we're done.
So thank you so much, Dr. Gunjit, for sharing all these tips, tricks, and the signs that we should take care of specifically related to our body, that our body is trying to tell us. So for everyone, as Dr. Gunjit mentioned, and she emphasized again and again on one point, that it is very important that you are heard properly. So at Zyla, we also make sure that all your symptoms, all the signs that you are mentioning are properly taken care of. And hence, we try to manage your health issues with a holistic approach, that is through nutrition, through exercise or physiotherapy, and if needed, through medicine or any supplements as required. So a triple combination approach for all your health related issues. So if anyone in your known is suffering from a health issue or is looking up for something that they want to work upon, we are here for them, and we would be really happy to help them with their health issues, to make them, or to provide them a healthier future. So now we would be taking up the questions that we have been receiving from the people here. Also, Dr. Kunji, thank you so much for sharing these specific tips and tricks. And many a times we usually ignore these signs and symptoms that we experience on a daily basis. हम daily basis पे हमारी body काफी सारे symptoms देती है, but mostly हमारी आदत होती है, we as humans or Indians, that हम इग्नोर कर देते हैं कि ठीक है अपने आप ठीक हो जाएगा, या let's wait for 2 to 3 days, ये अपने आप ठीक हो जाएगा. And I think it's now the high time that we should emphasize, as you also mentioned, that get a doctor's opinion. Even if it's something normal, it's good to get it checked. So जैसे हम कई बार होता है कि अगर कोई बहुत regularly डॉक्टर को विजिट करते हैं, we make fun of that person कि हर चीज छोटी छोटी चीजों के लिए आप डॉक्टर के पास जाते हो, get it done, get it checked at your home itself, वहीं पे ठीक हो जाएगा. But I think, as you mentioned, our body is trying to give us signs and symptoms continuously, so we should definitely get it checked. And as in our all webinars, we always try to say you that you should always have a doctor by your side with whom you can discuss all your health related issues specifically. So let's take up the questions now that we have received from the people specifically. So I think Mr. Dhananjayan already asked about warts, and Dr. Gunjit has already mentioned about the same. Another question is from Mr. Rajpal. Dr. Gunjit, he has mentioned that numbness in the fingers in morning and flashing bright spots. I think he is experiencing these symptoms. उनको शायद ये symptoms
Okay.
आ रहे हैं. So
okay, तो अगर आपको numbness है fingers में सुबह सुबह, and I would suggest आप वो एक बार check करा लीजिए. It can be a sign of early sign of osteoarthritis, can be, and depending on your age, could rheumatoid arthritis could also be in the picture. So अगर आपको सुबह सुबह numbness है, this is a very characteristic finding. Please reach out to your GP, or if you can, an orthopedist. You know, I would suggest go to your GP. They will send you to the people who are the specialist who's right for you. Definitely don't ignore this. और कुछ relief के लिए अगर आपको, you know, if you want some tips for relief, you can soak your fingers in warm water. That helps a lot with, you know, stiffness, numbness in the morning. And if you can, you know, do a few finger exercises, avoid holding your phone for very long. These things can help, but आपको genuinely एक doctor को दिखाने की जरूरत है. This is a sign that something is wrong. And I'm not going to make an official diagnosis, but please talk to your doctor. Flashing bright spots also not, you know, not something to ignore. Could be a sign कि आपके vision में कुछ है. And depending on your history, if you have diabetes, if you have any other issues, if you have blood pressure as well, please get an eye exam. And as you grow older, I feel people who are above 50, they should get an eye exam every year, because आपकी हमारी vision तो already, you know, compromise होती जाती है as we grow older, and we get diseases like diabetes as well. So always better to get an eye exam once a year, just to make sure everything's good.
Thank you so much, Dr. Gunjit, for sharing those tips. And also, Dr. Gunjit, currently we are now moving, you know, to an era or to a time where health awareness is very much important. आज के time में हम through these platforms, through these webinars, we are trying कि लोग जितना अपनी health को लेकर के aware हो पाएं. They can also understand, and as you mentioned, do not panic from everything if you notice something unusual from your body. There are some things that do not have a reason for. But उसके लिए panic नहीं होना है, और उसके लिए हमें, so Dr. Gunjit, to differentiate this, what is the, you know, time period, if we can say? I can understand there's not a defined time period, but if someone is experiencing any of the signs and symptoms, हमें कितने time तक wait करना चाहिए, or should we go to the doctor immediately the next day?
Generally, no one goes to the doctor immediately unless, you know, they are very, very, very anxious. And like I said, बहुत patients को, at least in my experience, they know something is wrong. आपको पता चल जाता है when, you know, I feel like it's a bit of it is intuition also. आपको पता चल जाएगा that something is wrong. Don't ignore that feeling, right? A lot of people dismiss that feeling. अगर आपको लग रहा है that something is wrong, something's not right, get it checked. And like you said, there's no I can't give you a defined time period, because it depends on the symptom, right? If you have chest pain, आपको immediately जाना चाहिए. Shortness of breath, सांस फूल रही है, दम लग रहा है, please go to your doctor immediately. Now, if it's something non-specific, like say stomach pain that's not going away, I'd say give it 2 weeks. 2 हफ्ते तक आपको continuously stomach pain हो रहा है, then talk to your doctor. So it depends on what symptom it is, and you know, there's no blanket advice I can give.
The severity,
but,
so you're mentioning the severity,
yeah, severity, the kind of symptom, right? So it depends on that. But I would say better be, you know, it's better to be cautious than to not care. So even if you trouble your doctor a lot, it's fine. That's what they're here to do. They're here to listen to you. So I would say utilize that fully, and talk to the doctor as often as you want, because 99 times कुछ नहीं होगा, but आपको एक बार भी कुछ detect हो गया, that's all you need, right?
Okay. So I think now people are mentioning all the symptoms that they have been facing. It's good, actually. Our motive is now, you know, achieved. Our mission is accomplished, that at least you are highlighting the symptoms or the signs that you have been facing and looking up to those signs. So few of them, Dr. Gunjit, that are mentioned here is, first is by Ms. Shalu, that skin besides nail is cracked. Anything to be worried about?
I don't know. Without seeing a picture, I can't say. Like I can't. I can't, it could be possible that, you have an ingrown nail or something. So I would say see someone who can see it and then tell you would probably be better. Talk to your doctor. And someone's mentioned that, and vertical lines on the nails also, check it out. It's probably a sign of some deficiency or something's not right. So I think Ms. Shalu has both. Get that checked out.
And also,
someone is seeing double. Yeah, sorry. Please go ahead.
Just to add upon that, if you are using currently the Zyla application, we would request that आप यहाँ पे जो भी symptoms share करें, we are sharing the symptoms here or the signs that you have noticed now. Please do share with us the pictures if you can over the Zyla app, and our team of doctors would definitely look into it and guide you with the next step. So अगर यहाँ पे जो भी आपने अभी तक signs and symptoms बताए, आप जरूर उनकी picture एक बार जरूर share कीजिएगा, so that next steps or next guidance के लिए हम आपको reach out कर सकें. Yeah, so Dr. Gunjit, you were, I think, mentioning about Miss Sarika's question that she sees double while watching TV on my phone, sometimes face of person.
That's also not a good sign. That's something that you should not be seeing double. It could be a sign कि आपकी vision blurry है, या it could be a sign कि आपके आंखों में कुछ issue है. So please get an eye exam. Like I said, anything which is unusual in your vision, straight seedha you should go to your ophthalmologist, because eyes are something that immediately if something is wrong you'll know. I've already mentioned numbness. अगर आपको हाथ में हो रही है, again talk to your GP. कहीं भी आपको सुन पड़ रहा है, and without knowing your history, you could be a diabetic, it could be a sign of neuropathy. So again, I cannot tell you just based off of one line. I would need to know your history. So please, if you have numbness, सुन पड़ रहा है, tingling हो रही है, आपको कुछ भी unusual sensations हो रहे हैं, please talk to your doctor. Sudden itching at groin after removal of underwear, that can actually be क्योंकि गर्मी हो रही है, तो I would say wait. You can apply some powder, make sure the area is nice and dry, avoid wearing tight underwear, make sure you're wearing cotton breathable underwear, and even if make sure your pants or jeans are not too tight, sometimes just that can help. But if it's a persistent problem, again get it checked out. It could be a yeast infection, it could be many things. So I would get that checked out. And someone has said if only one nail in the feet goes black and the rest are all normal. One nail going black again could be a sign कि आपको यहाँ या तो nail को कुछ trauma हुआ है, आपको वहाँ चोट लगी है तो नीचे कुछ blood clot आ गया है. एक बार अपने डॉक्टर को दिखा दीजिए, just to see कि if there is anything else that it could be. These आपको आप लोग जो questions पूछ रहे हैं आपको bother कर रहे हैं, and if it's bothering you, get it checked out. That's just my general advice. Yeah, I think that's all the questions, right?
Yes, we have covered all the questions. Thank you so much, Dr. Gunjit, for taking up the time and answering all these questions from the people that we have here. So thank you so much, everyone, for joining today's webinar. I hope you found it useful and it was helpful for you, for your family members. If there are any elderly people in your home or your children, I hope these signs and symptoms would help you to identify, even for the children who are not able to speak themselves or share with you. So you would be able to at least see those signs and symptoms and understand that something is not wrong, something is not right. So if there are still any questions, आपके कोई और भी सवाल हैं जो आप हमसे शेयर करना चाहते हैं, या अब आप नोटिस करना शुरू करेंगे अगर अपनी बॉडी में, तो do share a picture with us on the Zyla application, and we also make sure that regularly, weekly, we keep a check on your physical health. हम आपसे आपकी nail pictures, आपके feet के pictures, आपका urine का color, ये सारी चीजें इसीलिए मांगते हैं जिससे even if you are not able to look at those signs and symptoms yourself, at least through these pictures, we would be able to find some signs and symptoms, if present any, and help you at the right time in the right manner. So thank you so much, everyone. We have been receiving so many good responses in the chat application, Dr. Gunjit, that it was a great webinar. So thank you so much for being with us on this platform and making us understand the real meaning of the signs and symptoms and the secret messages that our body is trying to give us. Thank you so much.
Thank you, everyone. Thank you.
Thank you, everyone. Please take care. Good night.